Hi there, Elizabeth Scala here. Welcome back to our vlog discussing recovering from elbow surgery from the patient's perspective. And I'm here speaking to you about this as I am a patient that had elbow surgery and recovered or is still recovering and continues on a healing journey. So happy to help others who find themselves in this place. The thing I want to talk about today is something that I was terrified for, surgery itself. And as I've shared in another video regarding what to bring and not bring to surgery, I have plenty of things to say about the day of surgery itself. So I'm going to keep this specific to topic. Topic today relating to why was I so scared of surgery? The main reason I was not looking forward to having my operation was the very nature of what an operation procedure entails. Going under anesthesia, okay? I was worried about what would happen if it didn't work and I felt the surgery. Crazy thought, I know. I was also very afraid of coming out of anesthesia and the silly things I might say or how foolishly I might act. Nothing you can do about that either. But the main thing I was also not really looking forward to and wondering, I was very anxious, anticipating how this would go, was coming out from the anesthesia and if I would experience a lot of nausea and vomiting. I didn't want to be driving home from my operation with my head in a bucket, you know. Just feeling nauseous is something that I cannot stand. I'm here to tell you. Well, again, I'm not a doctor, I'm not a surgeon, I'm not the anesthesiologist, I'm a patient, but I'm here to tell you from my personal experience, and I'll tell you what my nurse said in a moment, but from my personal experience, don't worry about coming out of the anesthesia and feeling nauseous or vomiting. I had none of that. In fact, the first thing I said to my husband when I got back into his pickup truck after the surgery was, when do we eat? And here we go. I told my pre-op nurse, the nurse that was preparing me, getting me ready for surgery, I told her of this fear. And I said, oh my goodness, I'm just so worried of how, I don't like being nauseous. I hate feeling nauseated. It's just terribly obnoxious. And the prep nurse was so kind and gentle and caring. In fact, she inserted the IV into my arm, which I had to look away from because I didn't want to see. And then the IV was in and I said, you did a great job. I didn't feel a thing. And she said, you too, you didn't even flinch. Well, as I was talking to the surgeon and doing the consent form and making sure I didn't have any questions, and then he marked my arm with an X to make sure they were operating on the right arm, which was my left, the correct arm, I should say. The nurse said to me, he walked away and the nurse said to me, I've already started pushing in some antiemetic, and antiemetic means anti-nausea medication into your IV. And I said, oh my goodness, I didn't even feel it. I didn't even notice it. I don't feel it now. She said, and trust me, they will continue to do this throughout the surgery and they will monitor this medication so that when you wake up and you come out of anesthesia, you will not have any nausea and you will not have any vomiting. Now, I gotta tell you, every single human being is unique and different. So I cannot predict that you would have the same experience, but I want to try to ease any fears you have related to nausea and vomiting because I had none. I came out and was hungry, famished. I said to my husband, when do we eat? As I just shared with you. Now it's like really, really hungry in the car ride home and we stopped to get food. And then when we were back at my house, I sat on my front porch where I am actually today, propped myself up with my pillows, had pillows underneath my arm and it was all casted and bandaged, obviously, put ice packs on as prescribed. And I just sat there playing with my fingers with gravity because I got something called a nerve block, which you likely would receive as well. And the nerve block just had my arm like drooping, heavy. I couldn't touch it. Anyway, that in and of itself showed me that those fears, those anxieties, and those worries I had prior to surgery were not necessary, not in reality. These days, the medications they give prior to and during surgery will reduce nausea, reduce vomiting, and you will likely not have any of that at all. And you'll be home waiting for a big meal and having people wait on you hand and foot with water, juices, ice packs, and lots of food. So hopefully this has helped. Questions, leave them in the comments below. Or if you've had elbow surgery recently, I'd love to hear from you. What was your experience with nausea and vomiting? How did that go? So see you in the next video, and thanks for tuning in.